Right now, it's a race.
There's going to be variants for a long time.
The virus against the vaccines and the boosters, and possibly more boosters.
The company is forging ahead with an Omicron-specific vaccine.
But scientists have been working on what could be a better solution.
The urgent need of a universal coronavirus vaccine.
It's just what it sounds like. A vaccine that covers the circulating virus, yes, but also future variants we haven't even seen yet, and potentially other types of coronaviruses as well.
That means not only targeting SARS-like viruses, but then targeting MERS-like viruses, or then also targeting cold viruses.
Kevin Saunders is the director of research here at the Duke Human Vaccine Institute, one of the many groups racing to create a universal vaccine.
What we try to do is really target a specific part of the virus, for instance, that we know is its Achilles heel.
Now remember, viruses mutate all the time, so the trick is to find a stable part of the virus, a part that doesn't really change from one variant to the next, a common denominator. Saunders calls it a conserved site. Creating antibodies to that is one path to a universal vaccine.
So typically that's a place where the virus is binding to a specific protein on the host cell that it's targeting. And if it changes that site, then it's no longer able to infect.
A big clue came from someone who was infected with SARS all the way back in 2003.
What is DH1047?
The antibody DH1047 is an antibody that we found from a SARS-CoV-1 infected individual.
17 years later, in 2020, in the midst of the current outbreak, they found DH1047 was also protective against COVID, protective against a virus that didn't even exist when these antibodies were first made.
And so we took that antibody as a template to say there must be some site that's common between SARS-CoV-1 and SARS-CoV-2, and let's figure that out. Then we would know that needs to be in the vaccine.
There are a number of pan-coronavirus vaccine strategies in the works. But unlike the mRNA vaccines we've come to know, at Duke, they're working on something called a nanoparticle vaccine.
There's multiple sites that can be recognized by antibodies.
Think of it like a soccer ball, with tiny proteins stuck to the surface, each resembling a key conserved site of the virus's spike protein. So far in primates, the vaccine appears to work. And now, a similar vaccine developed by military scientists has already made it into early human trials. But as exciting as this science is, it's going to take time and patience.
I don't want anyone to think that pan-coronavirus vaccines are literally around the corner in a month or two. It's going to take years to develop.
Much of the work being done today on COVID is built on the back of similar research on other viruses, influenza, HIV.
We've been working on an HIV vaccine now for almost 30 years here at Duke. And HIV is one of the most rapidly evolving life forms on Earth.
That's because HIV mutates much faster. And that's one reason why Dr. Barton Haynes thinks developing a universal vaccine for coronaviruses may be easier.
Developing that platform for HIV over the last 5 years allowed this to happen when the need arose very quickly.
The most challenging part is that the virus is always changing. How do you predict what's coming in the future so that your vaccine can be effective against it?
And he's not just talking about coronaviruses that are infecting humans right now, but also novel ones that could still spill over from animals. Ones we don't even know about yet.
That's the type of vaccines we're going to need in order to prevent the next pandemic.
Jake, it's just really fascinating science. And I got to tell you quickly, that particular antibody, DH1047, they found it was protective against SARS, also SARS-CoV-2, but even other bat coronaviruses. So it could be a really wide-ranging vaccine. We don't know how long it'll last, but the Duke researchers say they think could last years as well. So you could have a long-standing vaccine that is widely protective, Jake.
Amazing. Dr. Sanjay Gupta, thanks so much. Joining us to discuss, Dr. Vivek Murthy. He's the U.S. Surgeon General. Surgeon General Murthy, thanks so much for joining us. How confident are you that a universal coronavirus vaccine could help us prevent the next pandemic, could become a reality?
Well, Jake, I think it's a very exciting possibility. There's certainly a greater chance of it happening in this day and age than there was 5 or even 10 years ago. And that's really because of the extraordinary advances in science that we've had. The fact that we have, for example, even now, mRNA vaccines that we've vaccinated millions and millions of people with in a short period of time, that's a triumph of science. But one thing just to keep in mind, Jake, is that as exciting as the science is, not just for a pan-coronavirus vaccine, but also for combining a potential flu vaccine and a COVID vaccine to reduce the number of shots people get, as exciting as these possibilities are, the benefits of science can only be extended to people if they have accurate information about vaccines and about other products of science. And one of the worries I have is that if we're not simultaneously working on trying to root out misinformation and elevate and uplift accurate information and accurate messengers, then I worry that a lot of the benefits that may come in the years ahead just may not be accessible to people.
What is a realistic timeline for when the first Americans could get one of the universal coronavirus vaccines, should they be discovered?
Well, I don't think that we're looking at something this calendar year. It probably would take on the order of several years for something like that to be developed and then fully studied, tested, and then rolled out to the public.
Just a few weeks ago, we were seeing rather insane lines of people waiting for hours to get COVID tests. Since then, the Biden administration has launched a program to send 4 free tests to each residence. Would you say the testing issues have been resolved, or they're just headed that way?
Well, Jake, I think certainly that they're getting better, and we're getting to be on the right track here. I think in addition to having, of course, the 20,000 locations where people can get tested, and in addition to what you mentioned, which is the test kits that are now being mailed to millions of households around the country, some of them have actually already arrived. There's now private insurance coverage that's required for 8 tests per person per month, another channel through which people can get tests. We know certainly as cases come down that may drop the demand for testing, but that's not going to make us let up on the push to get more and more tests out there. We'd rather have too many tests than too few tests. And the goal is to have a test for anyone who needs it, anyone who wants it, readily available at low cost or no cost.
You have been outspoken about the youth mental health crisis exacerbated by the coronavirus pandemic. So many kids being forced to stay home for so many months, denied the ability to socialize, to learn in person. Now, a lot of kids are back in classrooms, which is great, but we do see school districts, such as the one in Flint, Michigan, returning back to virtual learning. How much damage is that causing? And should the federal government be doing more to help these schools stay open safely, sending more tests, sending more vaccines, making it easier for parents to get their kids vaccinated?
Well, Jake, this is a really important question, one that's near and dear to my heart, the mental health of our kids. And you and I are both fathers. We, like all parents, care deeply about the well-being of our children. And one of the factors that's been important in the mental health of kids has been the stability in their lives. School is a big part of that. And so getting the vast majority, 96% plus of kids back to school in the fall was a really important step. Now, one of the things that I've been saying for a few weeks now is that during this Omicron wave, these are going to be tough weeks, and there are going to be emergency decisions that some schools are going to need to make on pulling back from in-person for a short period of time if they don't have the staffing, for example, to keep the classrooms open. Our goal should be to make sure that these are as short as possible, and we're doing a lot to actually support schools, in addition to certainly providing a lot of the funding for testing, billions of dollars, in fact, for testing, for masks, and for other precautions like improving ventilation. We are also offering a lot of technical assistance. We've doubled the number of tests that are available to schools right now. So we want to do everything we can to support schools, but we also recognize, again, this wave is tough, and some schools have had to make some tough temporary measures and decisions around pulling back. We just hope that will be as short-lived as possible, because getting our kids back in school is extraordinarily important right now for their learning, but also for their mental health.